Guys, welcome back to Medical Coding with Blue. It is Thursday. So I wanted to go ahead and just catch you guys up on what's been going on because there's so much going on. And I wanted to tell you about what happened during my meeting yesterday. So if you've been following along on my channel, I had taken some time off the past week because I was just taking some time for myself. And anytime I'm gone away from work for a while, it just like, and I was only gone like 4 days technically, you know, but with the weekend makes it 6. So it was just a good time for me to reset, but like I literally hit the ground running as soon as I came back because I had a meeting that had been on the books for a few months now with the PA students, and I had it at 8 o'clock in the morning. So I literally hit the ground running when I got back in. So I got everything that I needed to get for this meeting. I got all the slides and everything. And I went over to the section that they are in, which is in the ER section. And I couldn't find out where to go at first because I literally have no business being back in the ER. So I don't go to the ER. I stay in my section of the hospital and I'm okay with that, you know. But this time I had to like go. And so I kind of knew a general area of where to go, but I didn't know exactly where. And so I was like, okay, I need to find help. So I had some of my coworkers with me and they happened to run into me. It was 2 guys that I work with. And they happened to be walking down the hall at the same time. They were like, oh yeah, well, we'll just go ask one of the nurses. So I'm like, well, that's a good idea. And thank goodness for nurses, right? So this one nurse was like, oh yes, I know where to take you. So I was like, okay. So she escorted me back where I needed to go. And the guys took off. So I'm there and I'm setting up and I'm meeting all these people. And these are really nice people. I mean, they were very engaged. You know, they were asking lots of questions during the meeting. But I had something that happened that I didn't expect, okay? And of course, the quick thinker that I am, I'm like, okay, I can roll with this. Because remember, my motto is just go with it, okay? So I'm standing there and I'm introducing myself and I'm like, hi, I'm Blue, the coder. And, you know, I start giving, you know, a little bit about myself, you know, about my credential and that I'm with the American Health Information Management Association, credentialed through them. And so I'm telling them all of this stuff and then the door opens and one of the other coders busts into the room. Like she literally like opened the door like really quick and I'm just looking at her like, hello, you know? And she was like, oh, you don't mind if I sit in, do you? And I'm like, no, go ahead. So this coder happens to be the coder for the ER department. And so I don't mind. I mean, I'm like, okay, whatever, you know? But so she went and she sat in the back and I gave her a slide deck to, you know, follow along. And I told her to introduce herself since she was there and she had basically come in while I was talking. And so she was like, oh, hi, you know, she introduced herself and she's like, well, you know, you guys do really good in your documentation. We generally don't have any issues. So these PA students do like their rotations, okay? And so they have done rotations through orthopedics and podiatry and things like that. So some of the things that I had seen, some of them do were not correct. So we had that discussion at the time, and so everything was worked out and everything was fixed and we're all good to go. So she's telling them, oh yes, I generally don't have a problem with you guys do really good. So I was like, okay, you know, I didn't say anything, you know, and I was like, all right, you know. And so I'm standing up there and I'm giving the class, you know, and she's trying to find out where she needs to be, you know. And I'm telling her, you know, we're on slide 8, you know. And so I don't believe in trusting the projector. Although most people were like, oh, yes, just send in the slides. I don't trust that because too many times slides get lost or the projector doesn't work. And then you're just standing up there like with nothing. So I always like to give them something tangible in their hand that they can look at. And besides, it helps that they can write notes and things like that. So most people, when they're in those positions, they like to write things down so they can remember. So I started talking, and I told them I like to have you guys read the slides to me. So I will either randomly call on different people, or you can just go around the room and, you know, we can make this a discussion. I like to make things more of a discussion rather than I'm up here and I'm lecturing you. I like for them to read to me, because to me, if I'm sitting here reading this to you and you're following along on the slides, that's not really engagement. I've read so many articles about teaching techniques and things like that, where it's important to get the most engagement from the audience, so that way they can remember. Because if you listen to people that you know, sometimes hearing them say those things sticks better than somebody that you don't know. So that was one of the things that I thought of. So I was just like, okay. And so this is usually how I run my classes, where I'm having them read the slides to me. We stop on each page and I talk about, okay, well, I give them a more expanded, you know, either definition of something or a situational scenario for another thing. So that's what I do. And so she's sitting back there and she's watching me do this, you know, and she's watching me talk to them and you know, tell them, you know, who's next and things like that. And she's just like staring at me, you know, kind of with a little smile on her face. And so I'm like, okay, this could mean anything, you know what I mean? She's just a coder. She doesn't outrank me, you know, or anything like that. But it was just funny to see her watching me, you know. And so I'm standing there and we're talking about these different scenarios and things. And she happened to speak up. So she was like, oh yeah, she goes, but isn't that on an established patient? I'm like, we're talking about new patients. This is what we're talking about right here in the new patients. She's like, oh my goodness, I'm so sorry. She's like, oops, you know. And so I was like, okay, you know, no big deal, you know. She's asking a question. So we kept going along, and then the like fracture reductions got brought up, and she said something that wasn't right. And so I was like, oh, what do I do? So I was just like, okay. And I was like, oh, you know, just sort of I'm not calling her out. Okay, I refuse to call her out in this meeting, because, you know, again, this is what happens when you're having peers in the audience. You don't ever want to call them out and say, no, that's wrong, because then it goes back and forth, back and forth. So no, I'm not going to do that. So what I did was, I told her, oh, there's a coding clinic about that. And she's like, oh, really? She's like, can you send it to me? I'm like, sure, I can send it to you. And she's like, okay, you know. And so that's where the conversation died down. So I was like, okay, good, you know, because I didn't want them to absorb something that was incorrect, you know. And and it wasn't on the slide either. So she just happened to make the offhand comment. So I was just like, okay, let's just sweep that under the rug a little bit. So I was able to maintain control of the room as far as, like, you know, they had questions and they were asking me and things like that. So I was talking with one of the providers, and because he was asking a question during the meeting. And then I heard some other providers talking, and I know they were asking questions, but they were asking questions amongst each other. And I wanted to bring that energy back to the conversation. Because obviously this other provider on the other side of the room was trying to get his answer, and then these guys were, I guess, thinking at the same time. So I did have to, you know, look over, and they were like, oh, wait a minute, you know, let's direct this towards, you know, the coder. So, and that's like, I'll get to the question in a minute. So I finished answering this provider's question, and then we got back to their question, which was a very straightforward question. It was no big deal. But after the class, that particular provider that had the question, he literally brought me a list. And this is what I liked. So he brought me a list of all of these topics. He's like, you know, he goes, maybe next time when you have another class, he goes, I know you briefly touched on one of these topics that I would like. He goes, but what about all of these other things? Can you talk about these? And I'm like, sure, I am available to come back. Because these are, to have this spot as a guest lecturer is, it's open, you know, to whoever they feel. And these are slots that generally go to like other surgeons or other disciplines that come in, you know, and talk about, you know, their specialty, their practice. So that's generally reserved for them. So for them to get coding, they were excited about it. And he's like the manager that manages the whole program. He's very excited about it too. He's like, well, you know, after the meeting, when I had gotten this list, I was like, oh yeah, you know, I'm totally down with doing another class. Well, the program manager happened to hear that, and he gave me his list. He's like, this is a roster of dates. You pick your date. Whatever date you want to come back, you just go ahead and put your name down. I'm like, oh, okay. So I was like, this is awesome. So in October, I have another class. So that next class is going to be about modifiers, you know. So they were wanting to talk about modifiers and global days. They really want a little bit more expansion on that. And I'm like, that is perfect for me. I could totally get down with that. So I'm working on those slides currently, and I'm very excited about it. They're coming together very nicely because a lot of what I've already done with you guys, I've incorporated into these slides. So I'm like, yes. So it works out perfectly, and this is what happens. You know, I like sharing, you know, about coding and things that I know and answering their questions. And I love seeing that spark of, now I get it. I love that so much. I know I must sound nerdy, and even I told them, I'm like, look, I nerd out, okay? And they start laughing, and I'm like, I'm serious, because when a provider knows how to document, and I'm able to pull out more than what they had coded themselves, I said, it makes me happy, because I know that even though coding is not their job, coding is my job. That's why I get paid, you know. And for me, that I'm able to help that provider get more credit because they've documented so well, that's what I love. I love that. And I told them, I said, you know, you don't know who your coder is when you get out into the real world. You know, not everybody is not all coders are created equally. I say this a lot, and I say this because some people will push more, like me, like constantly pushing to learn more, and some people will be like, I'm just here to collect a check and go home. You know, this is a good paying job and that's all I'm gonna do. No, you can't do that. What we do, and I've mentioned this before, and I don't want to sound like a broken record, but what we do impacts facilities, it impacts providers, it impacts patients. You know, everything that we do impacts them as well. And so in order to have that good relationship and make sure that everything is being accounted for, we need to have that good communication. This is why I push for this every single time. And I tell even my coworkers, you know, are you talking to your provider? Well, they don't really want to talk to me. Well, how do you know that? Well, I don't feel comfortable. Well, you know, I used to be like that too, you know. And then it took one person to say, I want to hear from my coder more. And so that sort of opened the door. So like to thinking, well, if he's thinking this, then there's others that think this too, but they just don't want to say, you know. And like I said, somebody has to be the first person to say hello, you know. So this is why I always say that, because, you know, communication is just so important, you know. And so but getting back to the meeting so that I don't get too far off topic, but you know, after this meeting, you know, everybody was like, oh, you know, thank you for coming, and, you know, we appreciate your, you know, you taking the time and talking to us. And I said, good. And I said, because everything that you learn here, you're going to take with you anywhere you go, you know. And so the better trained you are, the better off you'll be. And they always say, oh yeah, you know, in our program, you know, we touch on maybe a few things about coding, but most of it's documentation, and then it's, you know, take care of the patient. So And I said, yes. And it takes somebody that's a coder that's patient enough to sit and make sure that you are getting credit for everything. You know, you don't want to get burnt out doing all of this work and it's not being fairly compensated, as far as like, you know, if you're not documenting it, it did not happen, you know, and we tell them this all the time. And so, you know, they were just very grateful. And so I was very excited because I got this second offer to come back and do another class. And so I was like, yes. So anyway, so I get back to my office, right? And the other coder, she leaves, you know, and so, she's like, can you make sure you send that to me? I was like, sure. And so when I got back to my office, you know, I sent her, you know, the, where in the coding clinic it was, you know. And so she writes me back and she's like, oh, thank you so much for letting me sit in. I really appreciate it. And, you know, I didn't mean to crash your class, but, you know, I just, you know, wanted to know, I thought maybe I had missed out on something. And I wrote her back and I was just like, no, you know, I don't mind that you were there, you know. And I'm like, but how did you find out that I was there? And she's like, oh, well, you know, I saw you. And then I heard some of the providers talking and I was asking them, you know, what's going on? And they were like, oh, you know, she's giving a class. And so she's like, I thought, you know, I'll just go ahead and sit in and, you know, see what's going on. And the thing about the fractures that we were talking about, and that I had sent her the coding clinic on, or the link for the location for the coding clinic, she was like, well, we haven't gotten guidance. She said this in the class too. She's like, well, we haven't gotten guidance on that. And I said, well, it's in the coding clinic. There's a coding clinic out on about it. And she's like, oh, well, can you send it to me? Well, the thing about coding, okay, you still have to educate yourself. And even if you think you're doing everything right, continue to read. You know, there are journals for certain, for every specialty. There are journals. The American Academy of Orthopedic Surgeons is one of the things that I look at, one of the resources that I look at, any articles that I can get my hands on from them, I look at, you know, because orthopedics is my specialty. I love, like I said, I love every single clinic I do, but that particular clinic I really like because I love injuries. I love talking about sequela. And so, you know, I don't know. I'm just weird like that. So anyway, I take the time to read, and whenever there's new coding clinics that come out, I take the time to look at those coding clinics to see if anything's going to impact, you know, my clinics at all, you know. And I guess she had not been doing that. And so she was like, oh, thank you so much for this reference. You know, we just never were told about it. But this is part of your job as a coder, is to do research as well. And so I told her, I was like, oh yeah, you know, sure. You know, anytime you have any questions, just let me know. But when you are doing injury coding, it is important to make sure that you are looking at different references, you know, not just going through the encoder and thinking that it's going to give you the correct code every single time. It does, but depending on what you choose is going to take you to a particular code. And so if you don't choose appropriately, you can end up with the wrong code, you know. So she was like, okay, well, thank you so much for your help. And I was like, how did you know that I was doing a class? She's like, well, you know, just, you know, hearing that you were doing a class. She goes, that's why I went. So I was like, oh, okay. You know, but I, you know, like I said, I'm really excited about doing the next class in October. And I'm already working on the slides because September is just going to come and go. And I am not going to be at work for most of September because I am taking other days off. I'm not gonna not film, okay? So don't worry. I will be filming. But I will have the week that I'm gonna be in Chicago in September, and so, you know, there's just all these things going on. So trying to get those submitted before September, so this way my supervisor has time to review these slides and she can have me make any corrections that she feels that is necessary. And so hopefully we can make sure that this is a efficient going back and forth, because if she tells me about the font, you know. But I'm going to use the same font size, so in case, you know, she has an issue with the font size, it's on the approved slides that she already approved. So hopefully this font size isn't an issue anymore. So anyway, but yeah, that was it. So wow, all that time on the meeting, but it was so productive, and I like that they were very engaged. So I did do the countdown days, just so everybody knows. So from now until September 14th, it is 30 days from today. And the official kickoff day, when everybody gets in and they have the welcoming ceremony on September 15th, that is 31 days from today. So, like I said, these are for the countdown days for the American Health Information Management Association annual conference that is being held in Chicago this year. I am very excited. And before I wrap up this episode today, the theme party, I found out today, the theme of the party for the appreciation celebration for the conference, it is the 80s, okay? So I am going to be deciding whether I want to look like Madonna or if I want to look like one of the ladies from the White Snake video. Because I love 80s music, okay? Like White Snake, Roxette, I love it, you know? I have very eclectic taste in music, okay? I listen to a lot of country. I listen to a lot of pop. Yes, Britney and, you know, Taylor Swift. Yes, I listen to it all, you know. And I do listen to a lot of pop. I listen to boy bands, NSYNC and, you know, Backstreet Boys. And you know, I just listen to everything. I even listen to some rap music, you know, if it's not too, you know, too wordy. I always pay attention to where I am, because I don't want to be listening to something inappropriate at work, you know. But I you know, I like everything, you know, so I will be doing some 80s research this weekend so I can decide what I want to look like in my costume. Of course, I have to consider that I'm going to be filming for you guys as well, so it's going to be a good time. So my friend from Italy, I told her today too, and I'm like, it's an 80s party! Because the first time that I met my friend from Italy, we met in San Diego, when they had the conference in San Diego. And Casey and the Sunshine Band played for us, so it was like a 70s theme party, you know, and so it was so much fun. But, you know, at the time, it was my first conference. I was just like, oh, you know, okay, this is cool, you know, and I never thought to dress up like a go-go dancer or something, you know, which would have been like a lot of fun, you know, but no, you know, but I got to see a lot of people in, you know, these big wigs and, you know, very cute dresses and things like that. So I'm like, okay, so every time there's a theme party, I'm going to make sure that I dress appropriately. So this weekend, I'm going to be looking at 80s stuff. So anyway, I'm very excited. And one other thing. So I found out that one of the other guest speakers is going to be John Quinones. So he's the one from 2020. He does that show, What Would You Do? You know, he, like, people get put in situations and like, what would you do? Would you help this person? Would you speak up? So he's going to be there. And I like listening to people who have gone through struggles and, you know, how did they make it through, and what was their focus for making it out of different situations and things like that. And also Carrie Lawrence, I hope I said that right, Lohrenz, Lawrence. She's the U.S. Navy first female F-14 pilot. She's also going to be speaking. So again, I really like listening to people who are motivational and who really have a passion for their career. I love that because I like that energy. I like knowing, you know, how do people process, like different people, how do they process, you know, their struggles and what did they go through, you know, to get where they are. So exciting stuff. So anyway, I'm going to go ahead and wrap this up because I'm getting long-winded. And yeah, that's it for today. So tomorrow will be Quiz Friday. I'm very excited about that. I will be throwing some new different ones on there because I've gotten a few emails, and one of the emails was bringing up about certain code set I haven't used yet. So I'm going to go ahead and touch on some of that, and very excited about it. So if you have any questions, I will include my email address down in the description box below. So if you have any questions, feel free to email me. All right, so if you are a medical coder, a medical coding student, somebody curious about the fascinating world of medical coding, a provider or a nurse, I invite you to like and subscribe and follow me on my journey in medical coding. I will see y'all tomorrow. Bye!